Other specified paraphilic disorders represent a complex and nuanced category within the broader spectrum of human sexuality and psychological conditions. These disorders encompass a range of atypical sexual interests and behaviors that cause significant distress or impairment to individuals but do not meet the specific criteria for the more well-known paraphilic disorders outlined in diagnostic manuals. Understanding these conditions requires a careful examination of their clinical presentation, diagnostic challenges, and the delicate balance between pathologizing sexual diversity and recognizing genuine psychological distress. The classification of other specified paraphilic disorders emerged from the recognition that human sexuality exists on an incredibly diverse spectrum, with some individuals experiencing sexual arousal patterns that deviate significantly from societal norms yet do not fit neatly into established diagnostic categories. These conditions are characterized by recurrent, intense sexually arousing fantasies, sexual urges, or behaviors involving atypical objects, situations, fantasies, or individuals that persist for at least 6 months and cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The key distinction lies in their specificity and the degree to which they interfere with an individual's ability to maintain healthy relationships and function effectively in daily life. Mental health professionals face considerable challenges when diagnosing other specified paraphilic disorders, as they must navigate the fine line between normal sexual variation and pathological behavior. The diagnostic process requires comprehensive assessment that considers cultural context, personal distress levels, functional impairment, and the presence of non-consensual elements. Clinicians must be particularly careful to avoid imposing their own moral judgments or societal biases when evaluating these conditions, focusing instead on objective criteria, such as the impact on the individual's well-being and their ability to engage in consensual, mutually satisfying sexual relationships. The etiology of other specified paraphilic disorders remains poorly understood, with researchers proposing various theories ranging from neurobiological factors to psychological trauma and learned behaviors. Some studies suggest that abnormalities in brain structure or neurotransmitter function may contribute to the development of atypical sexual interests, while others emphasize the role of early childhood experiences, attachment patterns, and social learning in shaping sexual preferences. The multifactorial nature of these conditions suggests that no single cause can adequately explain their development, and individual cases likely result from complex interactions between biological predisposition, psychological factors, and environmental influences. Treatment approaches for other specified paraphilic disorders typically involve a combination of psychotherapy, medication management, and behavioral interventions tailored to the specific needs and circumstances of each individual. Cognitive behavioral therapy has shown promise in helping individuals develop healthy coping strategies, improve emotional regulation, and address underlying psychological issues that may contribute to their condition. Acceptance and commitment therapy, mindfulness-based interventions, and dialectical behavior therapy have also been utilized to help individuals manage distressing urges and develop more adaptive ways of relating to their sexuality. The social and legal implications of other specified paraphilic disorders create additional layers of complexity for both individuals living with these conditions and the professionals who treat them. Society's attitudes towards sexual diversity continue to evolve, with ongoing debates about which sexual behaviors should be considered pathological versus simply unconventional. Legal considerations become particularly relevant when these disorders involve behaviors that may violate laws or social norms, requiring careful coordination between mental health professionals and legal authorities to ensure appropriate treatment while protecting public safety. Research into other specified paraphilic disorders faces numerous methodological challenges, including difficulties in recruitment, ethical concerns about studying vulnerable populations, and the inherently private nature of sexual behavior. Longitudinal studies are particularly scarce, limiting our understanding of how these conditions develop over time and respond to various interventions. The stigma associated with atypical sexual interests often prevents individuals from seeking help or participating in research studies, further hampering efforts to develop evidence-based treatments and improve outcomes. Cultural and cross-cultural perspectives on other specified paraphilic disorders reveal significant variations in how different societies conceptualize and respond to atypical sexual behaviors. What may be considered pathological in one culture might be viewed as acceptable or even valued in another, highlighting the importance of cultural competence in diagnosis and treatment. Mental health professionals must consider these cultural factors when working with diverse populations and avoid imposing Western diagnostic criteria inappropriately on individuals from different cultural backgrounds. The impact of other specified paraphilic disorders on relationships and family dynamics can be profound, affecting not only the individual with the condition but also their partners, children, and extended family members. Couples therapy and family interventions may be necessary to address the ripple effects of these conditions and help all affected parties develop healthy coping strategies. Partners of individuals with paraphilic disorders often experience confusion, betrayal, and emotional distress, requiring specialized support and education to understand the nature of these conditions and their treatment options. Prevention strategies for other specified paraphilic disorders remain largely theoretical, as the complex and poorly understood etiology of these conditions makes it difficult to identify specific risk factors or develop targeted interventions. However, promoting healthy sexual development, providing comprehensive sex education, addressing childhood trauma, and creating supportive environments for individuals with diverse sexual interests may help prevent the development of problematic patterns or reduce associated distress. The future of research and treatment for other specified paraphilic disorders will likely benefit from advances in neuroscience, genetics, and digital health technologies. Neuroimaging studies may provide insights into the brain mechanisms underlying atypical sexual interests, while genetic research could identify biological markers associated with increased risk. Digital health platforms and telemedicine may improve access to specialized treatment for individuals in underserved areas or those who face barriers to seeking in-person care. Ethical considerations permeate every aspect of working with other specified paraphilic disorders, from research design and diagnostic practices to treatment planning and outcome measurement. Mental health professionals must balance respect for individual autonomy and sexual diversity with a need to address genuine psychological distress and potential harm to others. The development of ethical guidelines and professional standards for working with these populations remains an ongoing process requiring input from multiple stakeholders, including clinicians, researchers, individuals with lived experience, and advocacy groups. In conclusion, other specified paraphilic disorders represent a challenging and evolving area of mental health practice that requires nuanced understanding, cultural sensitivity, and evidence-based approaches to diagnosis and treatment. As our knowledge of human sexuality continues to expand and societal attitudes towards sexual diversity evolve, the classification and treatment of these conditions will likely undergo further refinement. The ultimate goal must remain helping individuals achieve psychological well-being while respecting their autonomy and dignity, regardless of where their sexual interests may fall on the spectrum of human experience.